Hi, so we are group one, and we had case study number two, which was an ACL injury. So our client was Jimmy. He is a wide receiver on his football team who weighs 100 kilograms and is 6 foot 3. He demonstrated a hamstring quad test, and the results for that were 120 kilograms for quads and 45 kilograms for hamstrings. He has a past history of an ACL sprain earlier in the season, and as an exercise physiologist for the team, we recommended that he was at risk for an ACL injury. However, he decided to brush this off. During a football game, we watch him jump to catch a football, and he cut and plants his right knee into the turf. We watch him suddenly fall to the ground despite him being non-contact. Some of the signs and symptoms were he felt a pop as he landed from the catch, and he felt intense pain in his knee. When recommended to a physician, they diagnosed him as a complete tear of his right ACL and recommended surgery. So, how to mitigate initial risk? As part of the topical collection of ACL rehab, according to the systematic review, researchers found that programs which utilize neuromuscular training and strength training at a young age showed the most promise in reducing ACL injuries. While reading this review, we found multiple similarities to our client Jimmy and what he experienced. For instance, we saw that valgus stress on the knee and improper landing or cutting motions with poor neuromuscular control predisposes athletes to injury. In order to reduce this risk of injury, 20 to 30-minute sessions in ACL prevention programs should occur several times a week and begin in preseason, carried into regular season in order to see optimal effects. Prevention programs, which utilize a variety of modalities, including plyometrics, neuromuscular control training, and strength training, saw a higher incidence of mitigating risk. Preventative measures to see ACL injuries when implemented at a young age in comparison to older athletes in the same program.
In comparison to lay articles, some of the similarities are that both of the lay articles and the peer review research discuss neuromuscular training and proprioception. Neuromuscular training aims to prevent ACL injury. Proprioception has a great correlation with the health of an ACL and can prevent further ACL injuries in the future. Core strength is also mentioned in both articles. In the peer review article, trunk stability strongly influences knee control during cutting motions. Similarly, in the lay articles, core strength reduces the need to make compensatory movements which lead to injury. Some differences with the comparison to lay articles is that in the lay article, there is an emphasis placed on superficial preventative measures such as footwear and knee braces. These preventative measures create a sense of dependence on orthotics rather than strengthening the muscle itself. Diet and nutrition was also emphasized within the lay article. Eating foods like fruits and vegetables while staying hydrated play a role in injury prevention. Yes, getting the correct nutrients contributes to healthy ligaments. However, this article fails to mention the correlation between ACL injuries and faulty biomechanics.
There are a lot of effects that come after an ACL injury, which can include major consequences emotionally if not treated properly. Some of the main symptoms after an ACL surgery would be swelling and muscle atrophy, and recovery usually takes about 6 to 9 months. Fear of re-injury, called kinesiophobia, was the most common feeling in athletes who failed to return to sports after an ACL injury. In fact, there are approximately 250,000 to 300,000 ACL injuries a year. There are psychosocial effects like not being able to participate in games, fear of missing out, fear of re injury, and loss of mobility. Depending on the athlete's state of mind regarding their recovery, it could be a long road ahead, taking up to 12 months to recover. According to a systematic review article published in the Journal of Operative Techniques in Sports Medicine, there is increased research and evidence that psychological disturbances may affect recovery and returning to sport as well as increase the risk of sustaining a new injury. Findings suggest that an athlete's response to psychological stress can play a huge role in injury occurrence, and their perception of stress is likely to be influenced by a range of factors, including personality, available coping resources, and history of stressors, including physical and psychological. In fact, according to a study, those who had severe injuries that potentially threatened their future performance or career reported a stronger negative psychological response to those who saw their injury as minor. There is evidence that athletes who feel they have a greater personal control over their return to sport, greater confidence in their body, and more socially connected to teammates, motivation, self efficacy, optimism, and lower fear of newer injury are more likely to return to their previous sport of play. Psychological interventions aimed at self efficacy, addressing self efficacy and kinesiophobia early post op recovery, have the potential to contribute to improved short term rehabilitation outcomes after ACL reconstruction. In fact, there are correlations between self-efficacy and knee symptoms and function, which is measured with the knee injury and osteoarthritis outcome score after 3, 6, and 12 months of rehabilitation. One key psychological factor that I seem to notice is fear of re injury. A recently published meta analysis demonstrated a moderately large effect for low fear of re injury, which is measured with the Tampa scale for kinesiophobia, which favored returning to the pre injury level sport following surgery.
Okay, so for the experimental portion of the presentation, we looked into a simulation study about the influence of deceleration forces on ACL strain during a single leg landing. This was a research model conducted by Shin, Kadari, and Adriaki in 2007. The purpose of the study itself was to use a 3D dynamics simulation model of the knee to test the impact of deceleration forces on ACL strain during our run to stop single leg landing motion. The model of the knee was constructed from an MRI of a cadaver specimen from another experimental study, and the simulation of the knee model was used to replicate vertical impact loading during a single leg landing. In order to test this experimental apparatus, they applied an impact force on top of the femur by simply dropping weight on top of it. Then the information would be recorded through a load cell. The information recorded from the physical tests were analyzed to learn more about the relationships between knee flexion, quadriceps force, and ACL strain. They found that the posterior deceleration force during a run to stop can actually reduce the peak strain produced by the quadriceps, and this deceleration protects the ACL. In other words, by decelerating the body's forward momentum, one can influence the external posterior force applied. It was also found that the excessive quadriceps force is an unlikely mechanism of ACL injury when an external posterior force is present. This study also suggests that other factors are at work for ACL injuries, such as valgus rotation, internal rotation, or maybe a combination of the two because both are not protected by external loading. This experiment proves to be relevant to our case study because this experiment tests a similar motion to how Jimmy injured himself. Since we see Jimmy cut, plant his right knee into the floor after he landed from a catch, it is appropriate to compare the results of a run to stop single leg landing motion experiment to this case study.
Now we'll move on to recommendations. Jimmy's physician diagnosis was a complete tear of his right anterior cruciate ligament. Surgery is recommended to repair the ligament. So when we do surgery, there's a couple post-surgery recommendations that we researched and found. Some of those are that we restrict the weight bearing for several weeks, elevate and ice the knee to control inflammation. Usually the first 2 weeks, you get a lot of the inflammation. A lot of you can't really weight bear on your knee. Gradually work up to full knee extension and 90-degree flexion. So this is recommended at about 2 weeks. We want to see this progress where you can put a little bit of pressure on that leg, weight bear, and then you can gradually full extension and the 90-degree flexion as well. Patellar mobilization and to prevent tendon contraction or stiffness. This is important to make sure your tendon doesn't get stiff, and make sure it keeps it, prevents it from being immobile, basically. Use crutches is recommended for the first couple weeks. inhibit quadricep motion and strength. So the quadriceps are important because if you don't work them out, you'll get that muscle atrophy. So you lose the muscles, you know, size and strength. But if you keep that kind of moving around as the knee gets a little better, it's recommended because it will actually help the quadriceps strength. And another thing that isn't really spoken about, but I found research on, was seek mental professional assistance if feeling anxious or depressed. A lot of athletes, once they get that ACL injury, besides being painful, it's a long process. You know, as we talk about, it's about 6 to 9 months to recover from that. And a lot of athletes feel, anxious, depressed. They get, they don't, feel like they want to return to sports some. And it's something that is recently being researched, but is very important to talk about. Is make sure your mental health is straight before you can, during the process of getting better. After Jimmy fulfills his post surgery recommendation, he does have a high chance of returning to football with full athletic power. It says 83% of athletes that follow the recommendations post surgery have returned back to their sports with full power. So yeah, there is hope for Jimmy to get back, but he needs to make sure his mental and his physical is ready before he can start doing that.
And here is a list of our references.